Okay, so motility. We must move things from mouth to anus if we're going to have digestion occur. Okay, so we have various kinds of motions that occur. We have propulsive motions, right? Propulsion is moving forward, right? So we're moving materials from proximal to distal. Peristalsis is the most common form of this. Now, all peristalsis is we're taking material and we're pushing it along by squeezing behind it. Okay? The best analogy I can come up with is, imagine you've got an egg and you're trying to pass it through a stocking. How would you do that? Well, you'd kind of squeeze behind it and move it along, right? That's peristalsis. This sequential movement behind the material that pushes it forward. Okay, so that's peristalsis, movement forward. We also have mixing movements. In mixing movements, that's on this side, the primary mixing movement is segmentation. So here's our gut, here's the contents of the lumen. Now, the mucosa, I said, it pushes into the contents, right? So here, the mucosa is squeezing here, here, and here. But a few seconds later, it's going to squeeze here, here, and here, right? It's going to squeeze in the big spots. And then next, it's going to squeeze in the next bigger spots, and so on. So if we keep repeating this process, what we're doing is we're taking this material and we're mixing it up, right? So here, it's almost like, you know, that frosting that comes in the tubes, right? Well, one way you could mix it up is to just keep it closed, right? But squish, 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 squish. That's what segmentation is doing, okay? It's mixing things up from the outside, so to speak. Whoops, I need to go back one. All right. Okay, so we got mixing and peristalsis. The stimulation for peristalsis is usually distension, right? So if here's an area where the digestive tract has been stretched out, well, the response to stretch is motility. So that stretch is going to result in contraction that pushes that material forward, okay? Now, where are these happening? Principally, it's at the myenteric plexus, right? Because your longitudinal and circular muscles, okay, are going to be responsible for this bulk movement. She's carefully watching you, so just don't let her out there. In the absence of the myenteric plexus, which that's a disease state, okay, that's Hirschsprung's disease. In Hirschsprung's disease, we do not have motion in the areas where there's no myenteric plexus. So we know that we need the myenteric plexus to make mixing and propulsion happen, okay? Okay, so peristalsis, moving things forward, right? Segmentation, mixing things up. Now, a few other words, right? You know what a lumen is by now, okay? So lumen's the inside of the tube. That's where the work's being done, your digestion and absorption. And all of this motion is brought about. It's triggered by the enteric nervous system, and it's brought about by the smooth muscle cells and the calcium. As the nervous system depolarizes, calcium ions are allowed to enter. That causes contraction of that functional syncytium. Okay, so all